It's now 9:41 on the East Coast. We're giving you a live look right now at the tomb of the unknown soldier in the nation's capital. Today will be the last day it is open to the public. They're able to walk onto the plaza for the first time in nearly 100 years, and you can see how long those lines are there. People showing up to pay their respects, lay flowers ahead of Veterans Day. Now, since November 11th, 1921, the tomb has been the final resting place for one of America's unidentified service members from World War I. The remains of two other unknowns were added in later years. And the Biden administration this morning is beginning to focus on the mental health of both veterans and active military. Newsy's military affairs correspondent Terace Garnier joins us now live with one organization's effort to provide resources and break the stigma. Terace, good to see you. Good morning.
Good morning, Veronica. 6,200 veterans, or more than 6,200 veterans, died by suicide in 2019 alone, according to the Department of Veteran Affairs. But now the Biden administration is promising to take extra preventative measures after acknowledging that suicides are not only an issue among veterans, but also active duty military.
First of all, Terace, the president's plan is a good one. And it's nice to see that we're coming out with a presidential-led nationwide effort to address the problem of suicide for our active duty service members as well as our veterans.
Retired Admiral SNYDER is a board member of One More Day, a nonprofit organization committed to helping prevent suicides among military, veterans, and first responders. But his passion for helping others started several years ago when he was in charge of the Navy Suicide Prevention Program.
My very first command of a Navy helicopter squadron, one of my two senior enlisted folks died by suicide about 2 weeks after I took command. And I saw firsthand the devastating impact that had, obviously on that sailor, but that sailor's families and the rest of the organization, and stayed with me to this day.
Admiral SNYDER says combating this issue has been an ongoing challenge for years.
This idea that seeking help for mental health is somehow weak, or marks you as someone who's not successful. And so it's been a large effort on the military's part to try and reduce that stigma, both in policy and in action.
This university is about...
University of Memphis President Michael Rudd was very involved in the Department of Defense's 2018 suicide prevention strategy. He says the actions the Biden administration is currently taking are a good expansion on what has already been established. Those new actions include improving lethal means safety, enhancing crisis care and facilitate care transitions, increasing access to and delivery of effective care, addressing upstream risk and protective factors, and increasing research coordination, data sharing, and evaluation efforts.
I think one of the things that we know now is that some of these interventions that have proven effective, that have been helpful, that are very simple, really help people build some basic skills about managing their own emotional life, and how to manage their own emotional upset, and when they're struggling, when and how to reach out to get assistance if they feel like they're not able to manage independently.
But many refuse to seek help while in the military.
Ultimately, the concern is about the impact on career progression, the impact on your deployability, the impact on all sorts of things in terms of advancement. That's how stigma is maintained. I mean, those are the kind of things that we take a serious look at.
In 2020, 580 active, reserve, and National Guard members took their own lives, according to the Department of Defense.
We've been working on it for years to try and reduce that stigma, with some success, I believe, but it's not just a military problem. It's a problem for our military folks. It's a problem for society, and then it bleeds down into our veterans when they leave military service.
Women veterans die by suicide at almost twice the rate as civilian women, according to the Department of Defense. But SNYDER and Rudd believe that if service members can get the help that they need before leaving the military, that will lessen the number of veterans that feel the need to take their own lives later down the road. Back to you, Veronica.
So important to raise awareness around this issue. Terace Garnier reporting live for us this morning from Washington, D.C. Terace, we appreciate it. Thank you. And before we go to break, we want to give you another live look this morning at the Tomb of the Unknown Soldier. These are live images coming out of Arlington, Virginia, where, as you can see, people are there. They're paying respects ahead of Veterans Day tomorrow, leaving flowers. And as you can see, very, very long line there to get in. This is the first time in 100 years that the public has been able to visit the Tomb of the Unknown Soldier. We're going to have much more Morning Rush after a quick break.